Hey, good evening to everybody. Uh, I am Dr. Alok Sharma. I am doing this webinar from India, and the topic for today is recent advances in the treatment of autism, cerebral palsy, muscular dystrophy, spinal cord injury, and other incurable neurological disorders. And we are going to discuss what are the benefits of integrated therapies. Like when we do therapies together, what are the benefits? Why is it not? So, again, hello everybody, and Maraban, Jamina. I present this work on behalf of the NeuroGen Brain and Spine Institute, Navi Mumbai, and the Lokmanya Tilak Municipal Hospital. This presentation is for information only. This is not a substitute for medical consultation, for which you must consult your local doctor. And we gratefully acknowledge the role of Stem Cell Africa for inviting us to make this presentation. So, why are we all here? All right, I'm just going to continue till our Arabic translator joins us. So, what happens is, what is the current treatment? What happens is that you have been told that for your special needs children, those of autism and cerebral palsy, there is no cure. You have been told that there is no surgery that can be done. You have been told that only rehabilitation is possible. And you have been told that there are no medicines. And when your child has a problem, it may be a cognitive problem, understanding, speech, behavior, or it may be a physical problem in terms of not being able to move the hands or legs. And we have no cure and no solution. And I'm here to tell you that all this is now changed. So, we are going to discuss a combination of therapies. So, there is cell therapy, there is rehabilitation, and there is something called integrative therapies. So, three therapies together are going to help our special needs children, and we are going to discuss all of this today as briefly as we can. So once again, there are three different sets: cell therapy, integrative therapy, and rehabilitation.
عندنا العلاج بالخلايا، إعادة التأهيل، والعلاج المتكاملة فقط.
So this is a picture. On the left hand side, you can see a bone that is broken, that is fractured. And I ask you, if we were to have a broken bone, or if a child were to have a fracture, would we give rehabilitation on this broken bone? Okay.
في الصورة اليمين، وعندك في الصورة اليسار العظام كاملا. أسألك الآن، هل يمكنك؟
Now, if we had a fracture, we would not give rehabilitation on this. What we would do is we would get the fracture fixed with plates and screws and plaster, and we would give rehabilitation on a repaired fixed bone.
عندك في الصورة اليمين العظام المكسورا، وعندك في الصورة اليسار العظام المتكامل اللي صلح به. هذا هو عندك العظام في الصورة اليمين، عندك العظام المكسور، وعندنا في الصورة اليسار العظام الذي تم إصلاحه.
But this is exactly what we are doing with our children who have autism and cerebral palsy. On the left hand side, you can see a scan of the brain, and the blue area is the damaged area. We are giving rehabilitation on a brain which is damaged. Now, what if we repaired the brain? You can see this green which is repaired, and then gave rehabilitation on this. I ask you, will we have better results on a damaged brain, or will we have better results on a repaired brain? Zuleika.
عندنا في الصورة الموجودة عندك في الشاشة الشلل الدماغي اللي بالأزرق باللون الأزرق سوف نعيد إعادة إصلاحه عن طريق الخلايا الجذعية للتوحد لمرض التوحد. ممكن ترى عندك في الصورة التحسن عن طريق الخلايا الجذعية لزرع الخلايا الجذعية.
So the old thinking was that the central nervous system is incapable of regeneration or repair. That whenever
الجهاز العصبي
go ahead.
الجهاز العصبي المركزي غير قادر على التجديد.
However, the new thinking is that
التفكير القديم.
The new thinking is that when there is brain damage, it is possible to repair this brain damage by cellular replacement.
التفكير الجديد هنا أن بعض التجديد يمكن من خلال عملية استبدال وإصلاح الخلايا.
So that is why we call cell therapy an idea whose time has come.
لقد حان فكرة وقتها العلاج بالخلايا.
And stem cell therapy shifts us from a state of hopelessness to one of hope.
العلاج بالخلايا هو التحويل من اليأس إلى الأمل.
So the word stem comes from the stem of a tree. And just like from the stem of a tree, we give rise to branches, leaves, fruits, etc. There are some cells from which all other cells of the body can arise. And these are called stem cells. So a stem cell is a cell which can become any other cell.
ما هي الخلايا الجذعية؟ الخلايا الجذعية هي نفسها زي الشجرة التي تثمر تعطي لها جذور لها ذروع وبعدين يطلع لها الشجر والثمار. نفس الشيء هي الخلايا الجذعية للإنسان نفسه. تعطي الخلايا نأخذها من الشخص نفسه من المريض نفسه ليقوم إعادة تأهيل وإصلاح الخلايا التالفة لديه.
So stem cells are of two different types. We can get stem cells from our own body, from a child's own body, and put it back into us. This is called autologous transplant. Or you can get cells from somebody else and put it in our body. This is called allogenic transplant.
عندنا الخلايا الجذعية من النوعين. الخلايا الجذعية التي تؤخذ من نفس المريض نفسه هو نوع من الخلايا، وهناك خلايا جذعية أخرى التي تؤخذ من جسم المريض آخر من شخص آخر يعطيها للشخص المريض. نوعين من الخلايا الجذعية.
So stem cells are those cells which have the ability to repair, to replace, and to regenerate.
الخلايا الجذعية التي لديها القدرة على أن يصلح ويحل محل والتجديد.
So how do stem cells work?
كيف هؤلاء يعملون؟ الخلايا الجذعية كيف تقوم بالعملية؟
The first property of stem cells is they have an ability to multiply. So if we have a single stem cell, we can make thousands or hundreds of thousands of stem cells from a single cell.
إذا عندك في الخلايا جذعية واحدة تقوم تتضاعف هذه الخلايا الجذعية بإمكانها أن تتضاعف.
The other ability of stem cells is that they can convert into other cell types. So if you have a single stem cell, we can make the stem cell into a brain or into a heart or into a muscle or into any other cell. So this is a very special property of stem cells that they can become any cell of the body.
التحويل إلى أنواع الخلايا الأخرى هي التحويل إلى العضل، التحويل إلى الجهاز الدموي، التحويل إلى المخ والتحويل إلى القلب.
Stem cells also produce certain positive chemicals in the body, and these positive chemicals help in repairing the damaged tissue.
التأثير الباركين إطلاق مواد الكيماوية الإيجابية.
They also improve the blood supply. So wherever the stem cells go, the blood increases towards that area where the stem cells are.
تحسين تدفق الدم.
There are different types of stem cells. You can get stem cells from the embryo, which is the unborn. What is the problem? So you can get stem cells from the embryo, which is from the unborn fetus in the mother's womb. These are called embryonic stem cells. You can get stem cells in the umbilical cord. The umbilical cord is the cord that connects the mother and baby at birth. And you can get stem cells from our own body, from inside the bone. So 3 different types of stem cells. Zulekha, please explain. Embryonic stem cells are from the unborn fetus in the mother's womb. Umbilical cord is the cord that connects the mother and baby, and from the bone.
ما هي أنواع الرئيسية للخلايا الجذعية؟ هناك خلايا تؤخذ من الطفل. هناك خلايا تؤخذ من الكبر.
So embryonic stem cells have certain ethical issues, religious issues, and some medical problems. So we do not use embryonic stem cells.
العلاج في الخلايا الجذعية لم يأخذ للخلايا نأخذ من شخص آخر.
But adult stem cells, which are stem cells from our body's bone itself, these are very safe, and because they are from our own body, there is no risk. So we use adult stem cells taken from the child's own body.
الخلايا التي تؤخذ من نفس الشخص المريض هي الخلايا النافعة التي نستخدمها نحن عندنا.
So we work with adult stem cells because they are safe, they don't become tumors, they don't get rejected. It's very easy to get them, and there are no ethical issues.
لماذا اخترنا العمل مع الخلايا الجذعية؟ لأنها آمنة وغير الورم، لا رفض لها، يمكن الحصول عليها بسهولة، ولا قضايا أخلاقية عليها.
The ways stem cells are put, there are different ways in which they can be injected. One is by injection into the spinal fluid, into the spinal cord.
طرق الإدارة ممكن ناخذ الإبرة الحقنة نحطها بأسفل العمود الفقري.
This is with a simple injection, and from here the spinal fluid takes the cell straight to the brain.
ونحط الخلايا الجذعية في أسفل العمود الفقري وهو يمر إلى المخ مباشرة.
You can inject the cells also like a regular injection intravenously or intra-arterial, like how we give regular injections. Zulekha, please explain. It can be given as a regular injection also. Zulekha, are you there?
يمكن أن تأخذ الإبرة العادية.
So basically, what is stem cell therapy? We are using healthy cells, that is good cells, to replace damaged cells. So this shows the damage in a child with autism. When we put stem cells, the damage goes away.
هذه الطريقة العلاجية الجديدة وإعادة تضمن استخدام الخلايا السليمة لتحل محل الخلايا التالفة.
So what is the scientific base for cell therapy?
ما هي القاعدة العلمية للعلاج بالخلايا؟
The highest recognition, award or prize in the medical field is something called the Nobel Prize. Go ahead. And 3 times in 1990, 2007 and 2012, the Nobel Prize was given to stem cell research.
الاستفسارات التي أخذت عن في سنة 1990 و2007 و2012.
So what is the scientific basis of the work that we do at NeuroGen? So we have published at NeuroGen 101 scientific papers, of which on the role of stem cell therapy, 16 papers on stem cell therapy in autism, 15 papers on stem cell therapy in cerebral palsy, etc. Zulekha.
التوحد، مرض التوحد 16، والشلل الدماغي والشلل العضلي والجهاز العمود الفقري وسكتة الدماغ وغيرها من الأمراض.
Also, there are textbooks, medical textbooks, like there is this book, Recent Advances in Autism, and they have introduced a chapter, Stem Cell Therapy in Autism, and they asked, we authored this chapter, we wrote this chapter.
عندنا أيضا منشورات التي نشرت عن طريق مستشفى النيروجين، لقد طبعوها ونشروها عن الخلايا الجذعية.
Like this in book, this European book on cerebral palsy, there's a chapter stem cell therapy which we have written.
هذا أيضا المنشور الذي تم نشره عن طريق المستشفى النيروجين.
And in this book on physical disabilities, again, chapter on stem cell therapy in pediatric neurological disability, this is by us.
وهذا أيضا نشر المقال عندنا في المستشفى.
And in this book on muscular dystrophy published by Avid Science, the chapter stem cell therapy in muscular dystrophy is written by us.
وأيضا عندنا في الشلل العظمي الذي نشر بالخلال الجذعية عن طريقنا.
In India, the government at the highest level is very supportive of stem cell.
حكومة الهند هي أعلى مستوى داعمة للخلايا الجذعية.
Our Prime Minister, Honorable Shri Narendra Modi, when he went to Japan, he actually took out time and visited the laboratory of Professor Yamanaka, who won the Nobel Prize for stem cells.
أيضا الرئيس المودي عندما زار اليابان لقد ذهب إلى المختبر ليشهد الخلايا الجذعية في المختبر.
In India also, whenever possible, he visits stem cell therapy hospitals and laboratories.
أيضا في الهند الرئيس المودي زار المختبر عشان يشاهد الخلايا الجذعية.
I have the pleasure of meeting him. There is a book which I've written, and the introduction of that book has been written by Honorable Prime Minister Shri Narendra Modi. That is me presenting that book to him.
أيضا هنا لقد تشرفني اللقاء بالأستاذ المودي رئيس الهند الذي أعطيته الكتاب المنشور من قبلي.
And this is an introduction. You can see this is a book. It's in our regional language, and the Prime Minister has signed it. So this is the introduction that he wrote for our book.
وهذه المقدمة الكتاب لقد أعطيته وهو تم توقيعه باللغة العادية.
So let us look at how this treatment is done.
كيف يتم العلاج؟
So the treatment involves 3 very simple steps. The first is we put a needle into the bone just above the hip bone, and we take out the liquid in the bone called bone marrow.
لقد يتم الخلايا الجذعية في 3 مراحل. المرحلة الأولى نأخذ الإبرة ونعطيها في الورق ونأخذ السائل منه.
This bone marrow which we take out, we take it to our laboratory and we filter it and we separate the stem cells from it.
وبعد ذلك يتم سحب السائل ويؤخذ إلى المختبر ليفرز منه الخلايا الجذعية.
And the stem cells, once they are separated, with a very thin needle, we inject it in the lower back side, in the lower back, into the fluid in the back, because the fluid in the back takes it to the brain.
بعد المختبر بعد فصل الخلايا الجذعية من السائل نقوم بإعطائه للمريض أسفل العمود الفقري لأنه يمر مباشرة إلى المخ.
So the whole treatment has only 2 injections. With 1 needle, we take out bone marrow, and with 1 needle, we inject it back. Just 2 needle pricks. There is no operation, no cutting, no stitching. The whole treatment is done with 2 needle pricks.
العملية كلها تتم فقط لإبرتين. إبرة نأخذ منها نسحب منها السائل، والإبرة الثانية نضعها في تحت العمود الفقري. لا يوجد هناك جرح ولا قطع ولا أي شيء.
So this again just to show the 3 steps that we take. And now we show a video of how this is done. So you can see here the bone marrow being fixed. And then we take it to the laboratory.
الآن ممكن تشوف الفيديو كيف يتم.
We inject it into the lower back. We'll watch this video again.
نشاهد الفيديو مرة أخرى.
This is the bone marrow aspiration.
زرع الخلايا الجذعية في المختبر.
This is how we separate the stem cells.
لقد فصل الخلايا الجذعية من السائل.
And this is how we inject them into the lower back.
وهذا نقوم بزرعها في العمود الفقري، في أسفل العمود الفقري.
There were only 2 needle pricks in this whole procedure.
كل العملية مجراها تأخذ إبرتين فقط.
Now we will look at the results of stem cell therapy in various disorders like autism, cerebral palsy, etc.
ونشوف النتائج في كلها في التوحد والشلل العظمي والشلل الدماغي.
So the incidence of autism has been increasing very rapidly over the last 15 years.
لقد تم زيادة التوحد، مرض التوحد، لقد تم تحسن التوحد من سنة إلى سنة.
In 2004, 1 in 166 people had 1 in 166 children had autism. But in 2018, it became 1 in 59. And in 2021, it's actually even more. So there's been a 3 times increase in the last 15 years.
لقد زاد مرض التوحد من 166 إلى 1 بعدين إلى 1 إلى 59.
This means that 70 million people in the world have autism. 70 million. That is 1% of the world's population today has autism.
هذا يعني أن 70 مليون من الناس الذي مصابين بمرض التوحد، يعني 1% في العالم من مصاب بالتوحد.
So what exactly is autism? It is a neurodevelopmental disorder and it is diagnosed in the first 3 years. It occurs 4 times more in boys than in girls.
ما هو التوحد؟ التوحد هو أكثر إصابة المصاب به الأولاد من البنات.
The main problems in autism are problems with communication, social interaction, and repetitive behavior.
المشكلة الرئيسية في التوحد هو عدم الفهم والاستقلال لوحده.
So one question which parents often ask themselves is, why did my child develop autism?
وهناك الوالدين اللي يسألون ما هي المشكلة الأساسية الناتجة عن التوحد.
So there are different factors that can cause autism, and we will look at all of them. The first most important one is problem during, just before or during the birth process.
هناك أسباب ما قبل الولادة وما قبلها.
So, and if the mother has any infection during pregnancy, or if she has diabetes or even depression, then she is more likely to have a child with autism. Also, mothers who have ovarian polycystic disease problem or mothers who smoke, there is a greater incident chance that the child may have autism.
إذا الأم في وقت الحمل إذا عندها سكري أو عندها بتشرب بتدخن يصيب الطفل بها بالتوحد.
Older age of the father is also more likely to be a cause of autism. So if a man becomes a father at 45 years, there's a 3.5 times greater risk of having a child with autism than if he was a father at 24 years.
أيضا الشيخوخة الأب، إذا كان الأب عمره 45 سنة من المحتمل أن طفله يتم بالتوحد، غير أن الأب الذي عنده 24 سنة عفوا.
Also, children with autism have problems in the gut, and 9 out of 10 children having autism will have some gut issue.
يعاني الأطفال المصابون بالتوحد من تكوين غير طبيعي للبكتيريا في الأمعاء.
One of the things which is not very well known is that when the child is in the mother's womb, if the mother talks a lot on the mobile phone or uses the mobile phone close, then the radiation from the mobile phone can damage the brain in the mother's womb. So exposure to mobile phones during pregnancy is one cause of autism.
أيضا من العوامل الرئيسية التي تتعرض للمجالات الكهربائية والمغناطيسية استخدام الهواتف المحملة عند تحتمل الأم الحامل الهاتف الإلكتروني.
Also, heavy metals can very often cause autism, and these heavy metals include lead, they include mercury and aluminium. So lead, mercury and aluminium, if they are high levels in the child, it can produce autism.
التسمم الألمنيوني التسمم الزئبقي يؤدي الرصاص المرتفع كمان إلى إعادة ذهنية عند الأطفال.
In this research project done by an Australian university from Melbourne, they found that high lead was causing intellectual disability in children in India.
أيضا بالتحقيق أن يؤدي الرصاص المرتفع إلى إعاقة ذهنية عند الأطفال.
There is a controversy as to whether vaccines can cause autism spectrum, because there was a paper published in 1998 that showed some relationship, but this is very controversial.
اللقاحات المرتبطة بالتوحد تم اقتراح المواد الحافظة المستخدمة في اللقاحات لتكوين مسؤولة عن التسبب في التوحد.
But after that, there are 25 other articles that show that there is no correlation between autism and the MMR vaccine. So our medical advice to everybody is, please continue with your vaccination, because vaccinations are very, very important.
وبعد نشرت المقالات الكثيرة يقول إنه عملية التلقيح هو أهم شيء.
Now, this is a research which we have done at our hospital, and these are brain scans, and whatever you see blue is the damaged part of the brain. So we did scans, and for the very first time, we actually showed and published a paper that explained why children have autism, because a part of their brain is not functioning fully.
عندنا يظهر المناطق المتضررة في التوحد، عندك المناطق الزرقاء يعني المناطق التالفة في مخ الطفل.
And the details of our research are published in this paper in a very prestigious journal called the World Journal of Nuclear Medicine, where we actually showed what is the problem in the brains of children with autism. For the very first time, we showed that to the whole world.
هذا أول مرة نقدم للعالم أنه ما هو الشيء المصاب به الطفل.
So the management of autism is multidisciplinary. So we need many treatments all put together, and stem cell therapy is one of these.
إدارة التوحد هي من 10 سنوات تقوم بتغيير.
So among the treatments, we will list all the treatments. So one of the important treatments is something called applied behavioral analysis. And the basis of this is before any behavior, there is something that precedes it. And after every behavior, there is a consequence. So by changing what comes before the behavior or what comes afterwards, you can modulate the behavior. This is called applied behavioral analysis.
التحليل السلوكي التطبيقي قبل السلوك وبعد السلوك.
Occupational therapy plays a very important role in the management of autism, and there are different treatments included in autism, which include sensory integration, activities of daily living, etc.
العلاج المهني هو مساعدة الفرد المصاب بالتوحد لتحسين نوعية الحياة ودعم المشاركة في المهنة والأنشطة والمشاركة في العمل والأنشطة المشتركة.
Sensory integration is a very important part of the management of autism, and this requires a specially designed room like this room which is shown. This is from our institute, and these rooms are basically made to manage the sensory issues of children with autism.
العلاج الطبيعي العلاج بالمستشفى بعد أخذ الخلايا الجذعية ضروري جدا للتأهيل للطفل.
Speech therapy is another very important part of autism because a lot of children are non-verbal. So speech therapy is very important.
علاج النطق مهم جدا للطفل.
physiotherapy also has an important role because earlier it was thought that children with autism have no physical problem. But now we are finding that there are physical issues such as coordination, clumsiness, etc.
العلاج الطبيعي هنا مهم جدا. سابقا أننا كنا نرى أنه غير مهم العلاج الطبيعي للأطفال، لكن حاليا بالأمراض التوحد لازم به العلاج الطبيعي للطفل.
Aquatic therapy is a new kind of therapy where rehabilitation is done in the water. And this also causes a lot of improvements in autism children and cerebral palsy children.
العلاج المائي هو العلاج الحديث الذي أخذ نعمل به عندنا في المعهد اللي عندنا للطفل. يتم تحسين الطفل.
There are various art-based therapies which can also help children with autism.
هناك علاج القائم على الفنون في التوحد.
Hyperbaric oxygen, about which I will talk later, is also a very, very useful tool because...
العلاج.
Yeah, go ahead.
العلاج بالأكسجين عالي الضغط مهم جدا، سوف أتحدث له مؤخرا.
So in this chamber, oxygen is given under pressure, and because of that, it goes into all the deep parts of the brain and the whole body, and it helps in improvement of the brain as well as the rest of the body.
العلاج بالأكسجين عالي الضغط يتم إعطائه في الدماغ عشان يقوم بتحسين الخلايا التالفة لدى المريض.
In fact, I believe in this treatment so much that at least twice a month I take it myself.
وأنا أخذ نفسي أنا أخذه مرتين في الشهر.
Then there is a treatment called neurofeedback, which is where electrodes are connected to the computer, and whatever is happening in the brain, you can get a feedback from it.
الارتجاع العصبي الناتج عن طريق الكمبيوتر الذي ماذا يحدث خلال دماغ في الطفل.
There are some treatments which involve removal of heavy metals.
إزالة المعادن الثقيلة.
Then very often we give supplements to our children. This includes vitamins B, C, and the other things which are here. These are called supplements, and they are also helpful.
وأيضا المكملات التي نقوم نعطيها للطفل زي الفيتامينات، وهذه أشياء ضرورية، وبروتين هذه الأشياء الأخرى.
Diet has a very important role to play in the management of children with autism.
والنظام الغذائي والتغذية مهم جدا لأمراض التوحد.
So there are certain foods which we should give our children, like pro and prebiotics, like food which is gluten and casein free, things like camel milk and curcumin. These are good foods. And the foods to be avoided are foods with sugar, additives and pesticides.
أفضل ولا تفعل في النظام الغذائي. في هناك أغذية ممكن أن تعطيها للطفل تكون مفيدة لها زي الحليب والفيتامينات والأشياء الأخرى، وأغذية اللي هي ممنوعة للطفل زي الأغذية المرتفعة السكر وغيرها الأشياء التالفة.
A ketogenic diet which is high in fat, just enough protein and low on carbohydrates. A ketogenic diet is very helpful in autism.
الكيتون النظام الغذائي هو مساعد جدا للطفل إنه مرتفع في الدسم ومرتفع بالبروتينات.
But despite all this, are we doing enough? Because what we are seeing is that despite all our efforts, our children with autism still have behavioral issues. They still cannot speak. They still cannot go for a normal education. So all the treatments I've listed above before, they help, but the children still remain not independent and aren't able to come into normal life.
هل الذي نفعله ما يكفي لسه الأمهات تقول أن طفلنا لا يستطيع أن يتحدث، لا يستطيع أن يكون يمشي أو يعمل الأشياء لحاله.
So this is where the role of stem cell therapy comes.
هنا يأتي نظام الخلايا الجذعية.
We have so far treated more than 2,500 children with autism.
لقد عالجنا هنا 2500 مريض الطفل مصاب بالتوحد.
And this is data from 700 patients, which shows that 89% of our patients showed improvement.
هنا عندنا البيانات المريض بالتوحد 700 مريض الذي حصل له تحسن 89%.
Out of these, 33% of the patients had a significant improvement. That means they've come almost into normal life.
عندنا هنا 33% من الأمراض التوحد الذي صار طفل عادي يمارس الحياة العادية.
29% of the patients had a moderate improvement. That means they became independent, but they still had a few symptoms of autism.
29% تطور شوية أقل من السابق.
25% of the patients had a mild improvement.
25% متوسط.
And 10% of the patients did not improve.
و10% لم يتم التطور معهم.
Now, what we found was that this improvement had an age correlation. So all the children who we treated below 10 years, they came in this significant group. Children treated below 10 years were in this significant group.
هذا ما النتيجة الذي صرنا عليه. الأطفال الذين سنهم أقل من 10 سنوات تم علاجهم وتطورهم 100% تقريبا.
All the children between 10 and 11 and 20, they had a mild or moderate improvement. Children between 10 and 20. Yeah.
الأطفال ما بين 11 إلى 20 سنة تطور متوسط صار معهم.
And the children who were above 20 years, they came in the no improvement group.
والأطفال الذي سنهم ما فوق 20 سنة لم يتم التطور معهم.
So what this means is that the earlier we treat our children, the better results we get. Because when we are treating our children below 10 years, they are improving completely. And when we are treating our children after 20 years, they are not showing any improvement.
هذا يعني النتيجة الذي نصر له إذا كان طفلك أقل من 10 سنوات سارعوا في العلاج عشان يتم التطور. إذا استنيتوا وراعيتوا ل20 سنة يمكن يصير التأخير ولن يصير التطور مع طفلك.
So the important lesson in this slide is that the earlier we treat our children with autism, the better results we are likely to get.
النتيجة هنا الذي نطلع منها في الحياة إن هي سارعوا في علاج التوحد لأطفالكم. إذا تأخرتوا لن يصير الأمل هناك.
So on what basis can we make a claim that stem cell therapy works for autism? We can make it on two grounds. Either our results have to be statistically significant, or we must be able to show objective improvements on brain scans.
على أي أساس يمكننا أن ندع أن العلاج بالخلايا الجذعية يعمل مع التوحد؟
So this is just showing you when we take all our patients, we take an average of all the patients before stem cell, it was 4.5, and afterwards it was 3. This is a scale called CGI, and this was significantly improved. Again, on the Indian scale of autism, average was 115 before, afterwards it reduced to 97. This is significant.
عندنا هنا في الشاشة الجدول 405 لقد تم التحسن 3 وعندنا 115 لقد تم التحسن 97.
So this is one of the most important slides in my whole lecture. Zureka said,
هذا أهم مقطع عندنا
because this is showing above, you are seeing brain scans where the blue is the damage in the patient. This is the same patient. We are seeing on different from different angles where the blue is the damage in the patient.
العلامة الزرقاء تشير إلى المخ التالف لدى المريض.
And below is 6 months after the stem cell. You can see the damage above is very reduced. It's almost completely gone.
وبعد 6 أشهر ممكن أن تلاحظ أن العلامة الزرقاء العلامة التالفة تم إخفائها. تم التحسن.
This is before and this is afterwards. You can see that the damage is very much reduced.
هذا قبل اللي فوق واللي تحت ما بعد أخذ الخلايا الجذعية.
This is another scan where again above you can see the blue, which is the brain damage, and 6 months after stem cell you can see all the blue is gone.
وهذه أشعة أخرى الفوق اللي ممكن تراها اللي بالعلامات الزرقاء هي العلامة المصابة التالفة، وتحت بعد 6 أشهر بعد أخذ الخلايا الجذعية تم التحسن للمريض.
And here again you can see above scan, you can see, so we have more than 2,500 such scans. I'm showing you 2 or 3. Damage above after stem cell gone.
عندنا أكثر ما 2500 أشعة سوف نراكم 2-3 منها، وهذا نفس الشيء. عندك العلامات الزرقاء التالفة وبعد أخذ الخلايا الجذعية تم إخفائها بعد 6 أشهر.
Our results have been published in a prestigious journal, and the world's first international paper on stem cell therapy in autism was published by us.
أول مقالة طلعت بالتوحد بمرض الترحل الإصلاحه عن طريق الخلايا الجذعية.
After we published the first paper, the second paper came from China, the third from Italy, and the fourth and fifth paper came from the United States.
أول مقالة من الهند والثانية من الصين والثالثة من إيطاليا وأمريكا.
And apart from the world's first paper, we have a total of 16 scientific papers in different international and national medical journals.
لقد تم نشر 16 مطبوعة علمية في التوحد في العالم.
What is the importance of having scientific papers? The importance is that it means that our results, the improvements that we are seeing, this data has been studied by the journal and they have authenticated it by publishing it.
ما هو الهدف من نشر المرض الخلايا الجذعية اللي نعطيها بالتوحد للناس عشان تعرف الناس في العالم إن التطور الذي يتم به عن طريق الخلايا الجذعية.
Now a question very often parents have is, can stem cell therapy be combined with other treatments? And our answer is yes. You can. There is no other treatment that you need to stop. Stem cell therapy can be given with all the other treatments that are already going on.
يمكن جمع بين الخلايا الجذعية قبل وبعد مع العلاجات الأخرى.
So here, just to show you, we have a few movies that we'd like to show you, very small clips. We have children from 5 continents, one from America, Europe, Africa, India, and Australia. We just try to show you 1 or 2. And to show you what kind of improvements are possible in these children.
عندنا علاج المرضى من 5 قارات مختلفة. عندك من USA و UK وآسيا.
Here's the movie. Yeah. Translate.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just went backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall, and be talking to the wall. He had problems with eye contact. He never looked you straight in the eye. He had problems with his speech, and research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
You start seeing better eye contact, definitely different from his engagement with us, with his sibling, his mood. He's just so much calmer now. He's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So that was a video of a child from America. The father is a doctor, cardiologist. The mother was a nurse. This child did not have speech and several behavioral issues. He was in a special needs school. And from there, as you saw, he's back to a normal school. Not only is he in a normal school, he is topping all his class. He's getting A+ grades everywhere. He's getting a GPA of 3.86 on 4. In fact, his parents recently told me that for the first time in the history of the school, Ganesh got full marks in Spanish. No child had ever got full marks in Spanish, and he had got it. So this is the improvement that is possible. Now let's look at another film. I understand all of you have a child who has autism, many of you, and you know what a pressure it is to manage one child. The video we will now see is a family that has triplets, 3 children with autism. Can you imagine how challenging that must be? And let's take a look into their story and how all 3 of them improve with stem cells.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, because they're boys, they're triplets, they were premature. I'll be walking up and I'm like, bye. And my child is crying, my child is waving back by. And by then, for sure, I knew that they should be doing. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in the pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Thing that would have taken probably years to be accomplished in my son, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, takes a few minutes, and he's asleep.
See my son try we try to make them understand what it is to take a food. But after stem cell, when we arrived in Kenya the following day in the night, and this place could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
Yeah.
Okay. So I'm going to give you
Money.
for what?
Buy tomato. Money. Wow. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell work? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell work, I'll do it until my children get well.
So that was a family from Africa, and we'll just go on because for short of time. Now, very, very briefly, I will look at some of the other conditions. The first is cerebral palsy. How is cerebral palsy different from autism? In both, there is brain damage, but in cerebral palsy, the damage is a little more severe, and the problem is more in the body. In autism, the problem is more in the understanding. Whereas in cerebral palsy, there is tightness and weakness of the legs and hands. Zulekha?
ما هو أنواع الشلل الدماغي؟ ما هو الفرق بين الشلل الدماغي والتوحد؟ التوحد هو التالف في الدماغ في المخ، بينما الشلل أنواع الشلل الدماغي هو في الجسم نفسه.
So here in the scan, you can see the damage as compared to autism is more severe.
المناطق المتضررة في الدماغ في الشلل الدماغي.
There are certain medical and surgical treatments for cerebral palsy.
الإدارة الجراحية للشلل الدماغي.
But they do not correct the main fundamental problem in the brain.
بل لا يوجد أي تفسير للشلل الدماغي.
So let's look at what are the clinical results of stem cell therapy in cerebral palsy.
النتائج السريرية للعلاج بالخلايا الجذعية للشلل الدماغي.
Although we've treated more than 2,000 patients, this is data from about 600, and as you can see, 90% of the children show improvement.
90% أطفال يرون التحسن.
20% have a significant improvement that they become almost normal. 41% have a moderate improvement, 30% mild, and 10% don't improve.
نفس الشيء هنا 20% التحسن الكامل، 41% متوسط، 30% لا بأس.
The symptoms that improve, they include oromotor, drooling of saliva, it improves balance, the upper and lower limbs, and tightness of the hands and legs.
يقوم التحسن بتقديم الخلايا الجذعية للجسم والمخ والأعضاء.
And this is a PET scan. Above what you see is the brain damage in cerebral palsy. It is very extensive. And below is 6 months after stem cells. You can see it is very much reduced.
التحسينات الموضوعية ممكن أن ترى عندك في الأشعة السابقة المصابة بالأزرق التالفة، وبعد 6 أشهر تم التحسين بعد أخذ الخلايا الجذعية.
Here again on the left hand side you can see the brain damage, and on the right hand side you can see that the brain damage has gone after stem cell therapy.
وهنا أيضا ممكن تشوف بالأشعة بالجهة اليسار المواد الزرقاء هي في المخ هي المواد التالفة، وعندك بعد 6 أشهر التحسن بعد أخذ الخلايا الجذعية.
And our work is again published in a scientific paper. As you can see, this is a paper that shows the results of our treatment in cerebral palsy, published by us.
وهذا أيضا مقال نشر من قبلنا في علاج التوحد والشلل الدماغي عن طريق الخلايا الجذعية.
And apart from that paper, we have 15 total papers of stem cell therapy in cerebral palsy.
عندنا نقوم بنشر المقالات علما حول الشلل الدماغي.
Now we will see a video of a patient from Kenya, and you can see he was totally wheelchair bound, unable to use his hands, unable to stand, and let us see his improvements now.
نشوف معنا مريض من كينيا، الطفل الذي لم يستطيع المشي، وبعد أخذ الخلايا الجذعية نشوف النتيجة معا.
You can see the difference before. Now he can wear it. He could not earlier use his hands, and now he's able to wear clothes.
ممكن أن تشوف سابقا لا يستطيع أن يلبس ملابسه، وهناك الفرق الكبير.
He can stand, open the fridge, take out and drink water. Earlier he could not stand or use his hands.
سابقا لن يستطيع القيام. بعد أخذ الخلايا الجذعية شوف الفرق هنا عندك، ممكن يفتح الثلاجة ويشرب الماء بنفسه.
And from being totally wheelchair bound, now you can see that he's able to walk independently.
سابقا كان على الكرسي الويلشير، حالي بعد أخذ الخلايا الجذعية يمشي لحاله، لن يحتاج
Yeah, go ahead. So
لن يحتاج إلى أحد.
This is what stem cells do. They take a child who's in a wheelchair and get him back to his own feet.
هذا الذي يعمل به الخلايا الجذعية، يأخذ الطفل من الكرسي إلى القيام، يمشي لحاله.
Now the third condition we treat is something called muscular dystrophy, in which the muscles become weaker.
عندنا الشلل العضلي.
So in muscular dystrophy, what happens is, as you can see here, this is a scan. The gray is normal muscle at 5 years. And you can see over the years, the muscle becomes lesser and lesser. And by 16 years, there is almost no muscle. It's all white.
ممكن نرى هنا في الأشعة الحث العضلي تم نقصه. ممكن ترى بالأشعة بعد 13 سنة أو 16 سنة غاب.
I just got back into it. And this is a scan that is showing before and after. You can see that, at 5 years, normal muscle, 21 years is gone.
هنا ممكن تشوف بالأشعة 5 سنوات عندك الحث العضلي، وبعد 20 سنة اختفى.
So these are our results. You can see that in over 1,500 patients, 85% patients have improved.
عندنا 1500 مريض، منها 85 تم التحسن.
in which 4.5% had a significant improvement, 35 moderate, 20 mild, and 14% was stabilized. They remained the same.
عندنا 4 إلى 5% صار التحسن كاملا، 35 منتصف، 20% متوسط، و14% زي ما هم، لن يصير التحسن معهم.
And this is a comparative study where we compared patients who took stem cell therapy from patients who did not take stem cell therapy. In the blue, you can see patients who did not take stem cell therapy deteriorated like this. And the patients who took stem cell therapy, they improved and stabilized.
عندنا هنا بالتخطيط المقارنة بين المريض الذي أخذ الخلايا الجذعية والمريض الذي لم يأخذ الخلايا الجذعية. عندنا الخط الأخضر المريض الذي استخدم الخلايا الجذعية، وعندنا الخط الأزرق المريض الذي لم يأخذ الخلايا الجذعية.
And this is the proof. You can see the MRI above here. You can see this is white. There is no muscle. And after stem cells, you can see it has become black. So you can see that muscle has come back.
وعندك الإثبات البرهان الكامل هنا بالأشعة هنا السابقة لا يوجد لديه عضل، وبعد أخذ الخلايا الجذعية ظهر له العضل.
And this is an EMG which shows that before the stem cells, the muscles are working very weak. And after stem cell, you can see that the muscles are working very strong below.
وعندك التخطيط الكهربائي هنا الصورة الذي فوق الأشعة اللي فوق للعضل، وتحتها بعد الأخذ الأشعة بعد الخلايا الجذعية كيف صارت.
And all our work, we have 18 scientific medical papers on the role of stem cells in muscular dystrophy.
وعندنا مقالات علمية حول العلاج الخلوي في 18 ضمور العضلات.
And we will now see a video of this child from America. He had muscular Duchenne, muscular dystrophy. He was not able to stand or even walk. He could only crawl. He had not stood up for 2 years before he came to us.
الآن نشاهد معنا فيديو مع الطفل من أمريكا الذي لم كان يستطيع أن يمشي بل يحبي كان، وأتى لدينا وعملنا له زرع الخلايا الجذعية. نشوف معنا الفيديو.
And let us see how he improved after stem cells in this video.
ونشوف معا كيف صار معه التحسن بعد أخذ الخلايا الجذعية.
See, before he could hardly crawl.
هذا سابقا كان يحبي على ركبيه.
After stem cell, he started standing for the first time. He could not.
هذا بعد أخذ الخلايا الجذعية أول مرة إنه يستطيع أن يستقيم.
He started walking with support.
يمشي بمساندة.
And then started walking without support.
وبعد ذلك يمشي من غير مساندة.
In fact, President Obama heard of his improvements and he visited the White House and met President Obama.
الرئيس أوباما سار بزيارته.
So in intellectual disability also, which is a milder form of disability, you can see the improvements here. 20% had a significant improvement.
الإعاقة الذهنية أيضا.
And you can see this is the scan before. You can see the damage, blue, and afterwards you can see the damage is gone.
ممكن تشوف التحسينات الموضوعية عن طريق الأشعة.
And the world's first scientific paper on stem cell therapy for intellectual disability was published by us.
وهذا أول دليل نزل عن طريق الخلايا الجذعية من خلالنا.
And we have 3 other papers on stem cell in intellectual disability.
وعندنا أيضا 3 مقالات نزلت حول العلاج الخلوي بالإعاقة الذهنية.
This is a 26-year-old patient of intellectual disability, and you can see before and after the improvement on the right side.
أيضا ممكن تشاهد المريضة المصابة بالإعاقة الذهنية.
You see how faster she's writing and copying.
ممكن تشوف قبل وبعد بالشاشة عندك كيف تم التطور لديها
And
بعد
now,
أخذ الخلايا الجذعية.
an Indian instrument called the sitar, and performs classical dance.
الآن تقوم بالرقص
And
الكلاسيكي.
won a competition.
And with still perfect combination.
At a cooking competition.
وأخذت الجائزة.
In spinal cord injury, where the spine is fractured and people lose their ability to move the legs, otherwise these patients remain paralyzed for their whole life. But with stem cell therapy, we can make them walk.
العمود الفقري ممكن يأخذ بالخلايا الجذعية، ممكن يصير التحسن مع المريض المصاب بالعمود الفقري.
As you can see our data, 96% of the patients overall showed improvement.
1000 مريض.
And these are all the symptoms that improved. And our work is published in this international paper.
وهذه كل المقالات التي نشرت من قبلنا.
And we have a total of 9 scientific papers showing the improvements of the paralysis after stem cell therapy.
وهذه المقالات العلمية حول العلاج الخلوي في إصابة الحبل الشوكي.
This is to just show you a video. This was a soldier of the Indian Army who was shot by a bullet. He was totally paralyzed when he came to us.
ممكن مشاهدة الفيديو معا.
And when he came to us, he was bedridden. He could hardly sit or stand. And now we will see what improvements he had after stem cells.
نشوف معنا الفيديو للمريض المصاب بالحبل الشوكي.
So you can see now afterwards he's able to sit by himself.
هذا سابقا.
Now he's able to get up on his own.
وهذا بعد أخذ الخلايا الجذعية.
He can transfer from wheelchair into a car.
ممكن تحويله من الكرسي إلى السيارة.
He started walking. He was awarded Shaurya Chakra, what's a bravery award from the President of India.
لقد استلم الميدالية من الرئيس الهند.
And he joined back duty in the Indian Army. It is not often that soldiers who are paralyzed are taken back on duty. But he improved so much that he could actually join back duty.
لقد تم تحسن بعد أخذ الخلايا الجذعية ومارس العمل.
Then just 1 or 2 things more. In brain stroke, where there is a brain attack, 1/2 of the body gets paralyzed. And these are our results. They are very good results where 51% of the people had a significant improvement. Overall, 90% improved. And this is a scan which shows above the brain damage. You can see the brain damage above, and below you can see that the brain damage after stem cells has become much less.
هذا أيضا عندنا أشعة المريض المصاب بالشلل الدماغي. هناك الفرق الكبير، الأزرق اللي هو المصاب التالفة، وبعد أخذ الخلايا الجذعية بعد 6 أشهر يظهر عندك بالشاشة إنه تحسن وخفض.
And we have a total of 6 scientific papers on stem cell therapy in stroke.
وعندنا لقد نشرنا 6 منشورات علمية.
We will see a video of a school teacher who was paralyzed, who could not use one side of her body, and how after stem cells she improved and could start working again.
يلا بنا نشاهد الفيديو معا لمدرسة. المصابة بالشلل الدماغي.
Now you can see that she's able to walk independently. So as we can see that before she was not able to even get up, and now you can see that after the treatment she's improved to the point that she's able to use her hands and has been able to resume her normal duties.
ممكن أن نشاهد الفرق معها قبل وبعد أخذ الخلايا الجذعية.
Then in cases of head injury, nowadays with the road traffic accidents, you can have damage to the brain, and very often these people go into a deep coma and they don't recover from it. There's no other treatments available.
المصابين بالمخ لا يوجد لهم علاج، يذهبوا بالكوما.
So these are the results. As you can see, this graphic shows that 29% of the patients had a significant improvement, and overall about 95% of the patients showed good clinical improvement. 29 significant. Significant means they go back to normal life.
هنا أيضا ممكن نشاهد 29% التطور الكامل الذي حصل مع المريض.
And this is the scan. You can see the PET scan. Before you can see this brain damage, and afterwards you can see that the brain damage is significantly resolved.
وعندك الأشعة الظاهرة أمامك باللون الأزرق التالفة قبل وبعد أخذ الخلايا الجذعية، لقد اختفت، لقد تم التحسن، هذا عن طريق الخلايا الجذعية الذي أخذها المريض.
Now let's watch this video. This was a young man who had a very severe car accident. Before coming to us, he was in a coma for almost 2.5 years, totally non-responsive. And let us see now what his improvements are after our treatment.
يلا نشاهد معنا فيديو المريض المصاب بالحادث السيارة قبل ما يأتي لنا قبل 2.5 سنين، والآن نشوف كيف صار معه التحسن بعد أخذ الخلايا الجذعية.
And our work is published in this scientific paper. And we have a total of 2 papers in head injury. So here's the video.
يلا نشاهد معنا الفيديو.
So before you can see he's totally non-responsive, and after stem cells you can see him responding.
ممكن تشاهد قبل وبعد.
You can see afterwards he's sitting by himself and he's able to use the hand. Earlier you can see he's not able to use his right hand. Now he's moving his right hand.
ممكن تشوف بعد أخذ الخلايا الجذعية إنه يستخدم يده ويجلس ويأكل.
And you can see now that from being totally vegetative, unconscious, he's now able to use a mobile phone. Can you see? He's now using a mobile phone by himself. That's the kind of improvements that you can get.
شاهد إنه ممكن يستطيع الموبايل بعد أخذ الخلايا الجذعية.
The last thing that we treat is a disease called motor neuron disease, where 90% of the people die within 5 years. And this is a graphic to show you treated versus untreated. Untreated patients deteriorate like this, and treated patients in the blue color, they improve.
عندك المرضى الذي بالخط الأزرق هم الذي أخذون الخلايا الجذعية، وبالخط الأخضر الذين لم يستخدمون علاج الخلايا الجذعية.
And this is a work published in a scientific paper.
وهذه كل مقالات المنشورة.
So one question in all your minds must be, how safe is this treatment? Are there any complications in this treatment? This must be a question on all the minds of people who are listening.
كل هي الأسئلة التي بتكون ما هي المضاعفات.
So the complications after any treatment are two types: major complications and minor complications.
في هناك مضاعفات قليلة ومضاعفات أقل.
Now, with our treatment, there are no major complications or adverse events, and we have treated over 10,000 patients so far, and none of our patients has deteriorated or become worse after the stem cells.
لا توجد مضاعفات خطيرة أبدا إطلاقا بعد أخذ الخلايا الجذعية.
There can be some minor side effects. For example, if a child has epilepsy before, then in 3% of the children, they can have epilepsy after the stem cells.
هناك مضاعفات بسيطة ممكن يحدث للطفل.
But this risk is not there in children who don't have epilepsy. Then 10% of the kids may have headache for 1 or 2 days after the stem cells.
والمضاعفات البسيطة هي ممكن يحدث الصداع.
And 1 or 2 patients may have nausea, vomiting, etc.
أو المضاعفات الأخرى ممكن يصير بالطرش للطفل.
So basically, stem cell therapy is a very safe treatment because there are no major adverse events. There may be a few minor side effects, but they are treatable, and they do not cause any harm or damage.
لهذا الخلايا الجذعية هي عملية ليس خطيرة وممكن يحدث لها حاجات بسيطة فقط.
This is the institute, the NeuroGen Brain and Spine Institute, where all these treatments are done.
هذه المستشفى تبعنا مستشفى النيروجين
which is located in Navi Mumbai, India.
اللي هي في نافي مومباي الهند.
We have treated more than 10,000 patients from 70 different countries, from all the 6 continents.
لقد تم علاج أكثر من 10,000 مريضا من 70 دولة.
This is our core team. Apart from myself, Dr. Nandini and Dr. Prerna are the stem cell experts on our team.
هذا بغير أنا الدكتورة نندني وبرينا.
And Dr. J.
من فريق واحد.
Doctor is one of India's senior most respected physiotherapists, and he heads our rehabilitation team.
وهذا الدكتور جيكاب.
And Dr. Himangi Sane was a doctor from America. She herself developed a disease called motor neuron disease that I spoke about.
الدكتورة هيمانشي كمان من أمريكا، هي نفسها التي مرت بعملية.
In America, she was told there is no treatment for her, that she would not survive more than a few months. Zulika, go ahead.
لا يوجد لها علاج كان في أمريكا.
But she came to India. I treated her 10 years ago, and she has recovered so much that she now works with us.
وأتت لعندي أنا الذي عالجتها بمرض عن طريق الخلايا الجذعية، والآن هي تعمل معنا.
At NeuroGen, we believe a lot in quality control, so we have all these accreditations that you see, like good laboratory and good manufacturing practice.
وعندنا الاعتمادات الأكاديمية كاملا، ممكن أن تشاهدها أمامك في الشاشة.
This is just a picture of the stem cell laboratory where we do separate the stem cells.
هذا معمل الخلايا الجذعية الذي يتم.
We are accredited by the European Medical Association, the EMA, for best medical practices.
هذا الاعتمادات الذي أخذناها.
We have published, a total of 18 different books.
لقد تم نشر 16 كتابا مختلف.
And at our place, we have a multidisciplinary team, all rehabilitation therapists, doctors, all come together to give the best possible treatment.
وعندنا فريق متعدد التخصصات ليعطي أحسن النتائج.
We have received numerous awards like the prestigious Rose of Paracelsus Award from the Socrates Nomination Committee of Oxford, UK.
لقد أخذنا الميداليات المختلفة من أكسفورد بريطانيا.
We received this award from the European Society for Quality Research for Best Practices in 2018.
وهذا ميدالية أيضا استلمناها من بريطانيا.
And we got this, this award was given to us in the British Parliament called the Bharat Gaurav Award.
وهذا أيضا ميدالية استلمناها لأحسن علاج.
We got the award for the best stem cell therapy center in India at the National Healthcare Awards in 2016. And once again, we got the same award in 2018.
لقد استلمنا أحسن ميدالية في أحسن علاج معهد بالتطور في الهند للخلايا الجذعية.
To help you make the decision, you could visit our website, which is neurogenbsi.com. You could email us, you could WhatsApp us, or you could call us, or you could set up a Skype or a WhatsApp video interview with prior appointment.
لمساعدتك في اتخاذ القرار ممكن تزور الموقع عندنا هنا، وممكن تعمل لنا الإيميل البريد الإلكتروني، ممكن تعمل لنا واتساب، ممكن تعمل على الإسكايب انترفيو.
Once you've decided to do the stem cell therapy, we appoint a specific coordinator who will become your one point of contact for everything and will help you till you arrive at NeuroGen.
بمجرد أن تقرر أنك تأتي للعلاج الخلايا الجذعية نعين لك موظف أن يساعدك للوصول إلينا.
So the way it works is you have to arrive in India, Mumbai on a Sunday. On Monday, we do all the evaluations. Tuesday, we do the stem cells. Wednesday to Saturday is the rehabilitation program. And on Saturday, you get discharged.
عندك الوصول يوم الأحد إلى الهند. يوم الاثنين تقوم بالفحوصات. يوم الثلاثاء تقوم بعملية الخلايا الجذعية. يوم الأربعاء إلى يوم السبت يتم التأهيل. يوم السبت ممكن التفريغ.
Now, a question people ask is how safe and easy it is to travel to India for stem cell during these pandemic times. And we just want to show you a video of a patient who traveled recently. She explains what it was like to travel here. Explain that, Zulay.
كم هو آمن أن نذهب إلى الهند لنقوم بعملية الزرع الخلايا الجذعية في الوقت حاليا؟
My two names are Lauren from the Banda. I use Banda because I'm married. I am from Zambia. Zambia is a country in Africa, Central Africa. That's where I'm coming from. I came on the 27th of November from Lusaka, Zambia, via Dar es Salaam, Tanzania, to Mumbai, which is in India. I brought my son to the NeuroGen Institute, Brain and Spine Institute in Muscular, from Zambia to India. I traveled safely. All that is required to test for a person this time of the COVID travel is to have the COVID certificates, which I did. We managed to get them on time to travel. So traveling from Zambia to Dar es Salaam was all right. They did not ask a lot of issues other than the exemption certificates from the NeuroGen Center. That's the very most important document. That one is going to have to know that you have, otherwise they don't know anyone to play. So once they
saw that one. From Lusaka, Zambia, they asked the same whether in Mumbai when I arrived for the same place. The NeuroGen team have been very, very excellent in as far as giving documentation is concerned. They are efficient, they produce the information right on time. They never make money preparation. I have been on time. The NeuroGen Institute, the NeuroGen Center is very, very accommodating. Staff in my country, they are just giving visa for medical staff. It doesn't matter where I can go, but it has to be a medical visa. That medical visa is issued to the person who is currently sick, as well as the attendants or attendants. So the airports are not congested than before. The airports are just okay, but still, there are a lot of people available.
So that was just to show you that this travel is possible and convenient. So what's different about NeuroGen? We have the largest number of scientific papers in the world.
لدينا أكبر عدد من المنشورات العلمية في العالم.
When international book editors introduce chapters on stem cell therapy for neuro conditions, they always invite us to write.
عندما يريد المحرر الكتاب الدوليون تقوم فصول على العلاج بالخلايا الجذعية للحالات العصبية فإنهم يدعوننا للكتابة.
We are the only stem cell therapy center in the world that treats only neuro cases.
نحن المركز الوحيد للعلاج بالخلايا الجذعية في العالم الذي يعالج حالات الأعصاب فقط.
We use the safe adult stem cells and inject them intrathecally so it reaches the brain directly.
نحن نستخدم فقط الخلايا الجذعية الذاتية الآمنة فقط ونحقنها داخل القرى والتي تصل مباشرة إلى الدماغ المصاب.
We combine our stem cell treatment with a comprehensive rehab program.
نحن نجمع بين علاج الخلايا الجذعية وإعادة تأهيل الشامل.
We have treated more than 10,000 patients from 70 countries over the last 10 years.
عالجنا أكثر من 10,000 مريضاً من 70 دولة مختلفة خلال السنوات الماضية.
We have a team of experienced, very senior professionals.
إننا فريق من المهنيين رفيعين المستوى ذو الخبرة في العديد من التخصصات.
And we are constantly researching into newer and better treatment solutions.
نحن نبحث باستمرار عن الأسباب وطبيعة الضرر العصبي بالإضافة إلى الحلول العلاج الأحدث والأفضل.
And the work we do is approved and monitored by a government-certified institutional ethics committee.
تمت الموافقة على عملنا ومراقبتنا من قبل لجنة الإخلاقات المؤسسية المعتمدة من الحكومة.
So my final conclusions are that adult stem cell therapy, as we take from the patient, put it back in the patient, is a very safe and a very effective treatment option for autism, cerebral palsy, and many of the other pediatric and adult neurological conditions that I just spoke to you about, for which there are no other treatment options. So it is safe and it is effective.
الخلايا الجذعية البالغة الذي يتم أخذها من المريض وإعطائها بنفس الشيء هي خلايا جذعية آمنة وصالحة ولها تأثير في عدة من التوحد وعندك الشلل الدماغي والحتل العصبي والعمود الفقري وغيرها من الأمراض العصبية.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal, incurable are potentially retired from our vocabulary.
So that was President Obama talking about, stem cells, and you heard what he said. So again, I'd like to end with this picture I started. Right now, what we are doing rehabilitation on damaged brain. This is the scan of our children. And what I'm suggesting with stem cells and the other treatments, we repair the brain and then give rehabilitation. Zuleika.
عندنا هنا المرض الأزرق هنا الدماغ التالف، الخلايا التالفة، وبعد أخذ الخلايا الجذعية تم التحسن بعد أخذ الخلايا الجذعية والتأهيل بعده.
So the future of cellular therapy is in a very exciting field called anti-aging. And in anti-aging, we can actually slow down the aging process in people.
مكافحة الشيخوخة.
Yeah, go ahead.
الآن نقوم بباحث المكافحة الشيخوخة.
So anti-aging combines, it's a scientific approach where we combine modern Western technology with ancient Eastern medical systems. And together we come up with a treatment which can help in slowing the aging process. Zuleika.
Yeah. عندنا العلاجات الظاهرة هنا الذي يساعد على تخفيف مكافحة الشيخوخة.
So the various conditions that can be treated with this anti-aging includes diabetes, obesity, menopause problems, osteoarthritis, and all the conditions that you are seeing there, which include stress and palliation from cancer.
ممكن أن تشاهد هنا مكافحة الشيخوخة الذي ممكن كمان يستخدم في مرض السكري والسمنة وغيرها من الأمراض.
So these are the different kinds of therapies that are available. So from modern Western technology, we have treatments like hyperbaric oxygen, ozone therapy, cellular therapy that we heard about, hormone therapy, cryotherapy. These are from the modern medical world. And from ancient Indian systems, we have treatments like colon hydrotherapy, naturopathy, yoga, and acupuncture. And this combination helps in boosting our immunity and helping to slow down the aging process.
عندنا العلاجات المتاحة المختلفة هنا، العلاجات الحديثة المستخدمة، العلاجات الطبية والعلاجات عن طريق التأهيل، وعندنا عن طريق اليوغا والحاجات المختلفة التي تساعد المريض للتحسن.
So these are the different integrative therapies. The first one of this is something called ozone therapy.
وهذه العلاجات المتكاملة العلاج بالأوزون.
So in ozone, like oxygen is O2 and ozone is O3. So it's a very powerful form of oxygen.
هذا العلاج بالأكسجين هو 100% مساعد بالأكسجين، العلاج بالأكسجين.
So oxygen helps in combating infection. It helps in boosting our body's immunity, and it overall improves oxygenation to all parts of the body.
الأكسجين هو يساعد لتجديد النشاط في الجسم.
Then we have colon hydrotherapy, where the gut is cleaned from the inside.
أيضا لدينا العلاج المائي للقولون.
Then we have cryotherapy, where by cooling the body, it helps in reducing pain and swelling.
أيضا عندنا العلاج بالتبريد للجسم بالكامل. هذا يساعد على تخفيف الوجع في الجسم.
Infrared therapy uses heat to do exactly that, and it helps in healing of deep tissue, various skin disorders also.
عندنا أيضا علاج السونا الأشعة تحت الحمراء التي تساعد الجسم بالتحسين.
Then we use high dose intravenous vitamins and other supplements to help in healing the body from damage.
أيضا عندنا علاج الفيتامينات الرابع الذي يساعد الجسم للتحسين والنشاط.
So this combination of treatment, which is called integrative therapies, is very, very useful. We are using this for our children with autism, cerebral palsy, as well as using it for older people for anti-aging.
هذه العلاجات التكاملية في الملحق هي مهمة جدا وحديثة، نستخدمها للأطفال الذين مصابين بالتوحد والشلل الدماغي.
So I'd like to end by saying again, once again, that stem cell therapy is an idea whose time has come.
لقد أنهي الآن معكم الكلام بأن العلاج بالخلايا الجذعية لقد حان وقته وفكره.
And with that, I'd like to thank you, shukran.
وأشكركم الآن لمتابعتكم معنا.
I am now available to answer any questions. So if any of you have any questions, please, you're free to ask and I'll answer all the questions.
الآن أنا مستعدة معكم لأي استفسار لأي شيء. أنا معكم هنا لرد أي استفسار لديكم.
So the first question is from Mary Gorati Apondi. She asks, hello, do you need to have hormonal therapy first for autism in order to perform a stem cell operation? And the answer is no. We do not need to do hormone therapy at all for autism spectrum disorder. We can directly do stem cell therapy, and stem cells will repair the damage in the brain. So there is no need to do hormonal therapy before. The second question is from John Diongesa. In case of autistic children, do you sedate them before injections? Yes, we do sedate them before injections. We give a very short-acting sedation, and we also give local anesthesia. And this helps us to do the procedure fast. We do not use full anesthesia, just short-acting sedation. Stanley Mabugo asks, are you able to visit other countries like Kenya, or one has to come to India? Well, presently for this, one has to come to India. This is not available in in African countries or anywhere outside of India right now. But it's likely that in some time, in maybe a year or so, this may be available. Any other questions? Huh? Okay. Evan Chaggy asks, please comment on the effectiveness of stem cell therapy in Down syndrome. Most of the cases seem to handle our autism. Yes, that's true. The largest number of patients we've treated, out of 10,000 patients, 2,500 had autism, but we've also treated over 100 cases of Down syndrome. Now, about Downs, I have to say that when we treat the Down syndrome, what we are doing is we are repairing the damage in the brain of the Down syndrome children. We are not curing the Downs, because Downs is a genetic problem. Just like if a Down's child had a hole, very often Down's children have a hole in the heart, and that hole in the heart has to be repaired. So when you repair the hole in the heart, you're not curing the Downs, you're just repairing the cardiac damage. Children with Downs also have brain damage. And with stem cells, we repair the brain damage so that their speech, their behavior, and all other independent activities improve. So yes, we can treat Downs. We've treated lesser Downs, I agree with you, but we've treated over 100 and they do very well. All right, if there are any more questions, I'd be happy to answer them.
أي استفسار أي سؤال لديكم؟ نحن مبسوطين للرد عليها.
All right. If there are no more questions, I will request Ms. Jigyasa to take over further. And I'd like you all to know that all those of you who attended today can have a free medical discussion with me at a preset time. You can talk to me one-on-one about your children, about the problems, any questions you have. So we can have a personal discussion, one-to-one, and Ms. Jigyasa will coordinate with you. At this point, I'd like to thank once again Stem Cell Africa, in particular Annelien Theissy, who's was instrumental in making this webinar happen. And I'd hand over to Ms. Jigyasa, and please take advantage of the opportunity to have a one-on-one discussion with me. And it's free of cost, doesn't cost anything. But all the questions you always wanted to ask. There are so many questions in your head about, why your child is autism, the symptoms, what can be done. So I'd be happy to answer all of these. With that, I'd like to thank you for your attention and wish you a very good evening, good night, wherever you are. Shukran. Thank you.
شكرا جزيلا لكم لمتابعتنا معنا.